So our next speaker is Stephanie Cowle. Stephanie here. Stephanie has spent more than 8 years working in the area of injury and trauma preventions. She's a manager of knowledge translation at Parachute, a national charity focused on preventing serious and fatal injuries through evidence-based solutions that advocate and educate. Since 2016, Stephanie has led Parachute's national project to improve concussion protocols across Canada, including the publication of the first ever Canadian guideline on concussion in sport. Her experience includes working directly with government, health, sport, and education stakeholders at national, provincial, and local levels.
Thanks very much, and I'm definitely going to switch gears on us here and talk more about knowledge translation. We've had some hints of that throughout the day. Thank you, Dr. Stewart, for starting us off on the importance of knowledge translation and getting research evidence, not just into the hands of people, but into the hands of people in forms that they can use in their context. So I'll talk about what Parachute has been working on in that regard related to concussion. Thinking about a little bit of context around this, in 2015, Prime Minister Trudeau, in his mandate letters to the Minister of Sport and Persons with Disabilities and the Minister of Health at the federal level, directed the ministries to work together towards a national strategy for concussion in Canada. And this really came out of the recognition that there was no consistent approach to concussion in our country. And, Dr. Tatter talked a little earlier about how everyone's moving faster than the science. Once concussion started rising in the spotlight, we saw everyone jumping to action, which is great, but there was no coordination on how this took place. So we end up with this patchwork of, we have some protocols, some information, some things all over the place, and we have a little bit of confusion of people knowing where to go and what's the right information to use. So Parachute was tasked by the Government of Canada to lead a large part of this national strategy. Parachute is Canada's leading national injury prevention charity. We focus on preventing serious and fatal injuries. In terms of the strategic priority areas of our work, it is in road safety and in concussion. There's lots of other areas of injury. It's a huge field. We do a little dabbling in those, but these are our focuses right now. And we really do focus on evidence-based solutions. Everything we do at Parachute, all of the information we use is evidence-based. And we do have a broad expert advisory committee as well as a committee devoted to concussion with clinical and research experts from across Canada. I'm going to talk about two of the objectives in our harmonization project. One, to harmonize protocols across amateur sport organizations with a specific focus on national sport organizations, and also about enhancing medical professional competencies through medical practitioner training. And we've talked a little bit about what is best practice, how do we get information into the hand of medical professionals. So Noah will continue to talk later on about that piece. In terms of how do you get from point A to point B with the evidence? So we started with the idea of taking the international systematic evidence and putting it into the Canadian sport and health context in the form of a guideline, similar probably to the approach taken overseas. From that guidance, though, we took it a step further and built tools that could be used for implementation of this guideline directly in the sport organization context. We also looked at the return to sport strategy from Berlin and worked with sport organizations to make strategies that are sport specific to their athletes. And then in the area of medical education, we identified priorities for where this training needed to focus and continued to develop an online concussion course. This is a huge collaborative effort, and necessarily so. Concussion is not a sport issue, just a health issue, just an education issue. It crosses all of these different systems, and we all need to work together. Parachute, through our work, relies heavily on partnerships, and no different in this project. So working with a number of different partners at the national, provincial, and territorial levels. In terms of taking the evidence down to the practice level, we had to go through different levels of evidence distillation. So moving from evidence to the on-the-ground implementation, moving from the international context to thinking, how is this going to work in Canada, and then how is this going to work on the ground in sport? And so our first step was producing the Canadian Guideline on Concussion in Sport. This is not a clinical practice guideline, though we did use the agree to principle to drive the rigor of development of this document. This is for all stakeholders. This is for a sport administrator, a parent, a coach, a teacher to pick up and say, here's the steps of a best practice approach to concussion. And that's freely available in English and French on the Parachute site that anyone can download and use. It focuses on a comprehensive approach to concussion. So one of the things we've seen in protocols is they begin after the injury has already occurred. How do you manage concussion? But we want to talk about how do you educate, how do you prevent, how do you recognize and get the right care in the first place. So the approach is really that comprehensive thing. In addition to including some of the assessment tools from the Concussion in Sport group, we also added some new tools for ease of implementation, providing that pre-season concussion education sheet. So organizations may take a different approach to education, but they have that sheet that has the information at hand, and so they can implement it in whatever education program they want to design. We also provided standard assessment and clearance letters that could be used across, again, so that this looks more familiar to physicians, and it was developed with our physicians, so they felt this is something I would actually fill out. I'd be willing to check a box and sign, and that's really important because we talk about barriers and we don't want to create more of them. So our next step, but all happening concurrently really, is engaging our national sport organizations. And of course, this draws from the fact that the Ministry of Sport was involved in this mandate. So there are 56 national sport organizations in Canada that are funded by Sport Canada. We reached out to all of them with information about this effort and what we wanted to achieve. They had no mandate to work with us, though certainly Sport Canada has been very supportive and strongly encourages the NSOs to work with us. And our goal was to engage throughout the project 20 NSOs to update or develop new concussion protocols harmonized with the Canadian Guideline. Our introduction to these NSOs, most of them, which we didn't have relationships before, came through Sport Canada, and that was really, really important that sport organizations have a lot of people showing up at their door and saying, we want to work with you, we want to do this with you. And so it can be tough for them to judge who they want to work with, and they have so many demands. So for us to go through Sport Canada, through the Director General to say, here's an important initiative, here's where it fits within everything else we're doing around concussion, pay attention to this. We, throughout the process, really carried out ongoing consultation, ongoing communication. It's really important that when you're working with community stakeholders that you do this. It sounds like a no-brainer, but it's something you really have to pay a lot of attention to so people feel listened to, engaged, and that you're respecting the input that they do give you and you're putting it into your materials. And so our work with them included some in-person work, bringing all our stakeholders together, but then also ongoing communications through various uses of technology and phone and you name it. In addition to talking and working with the NSOs, we provided them with custom tools and supports to work through developing their harmonized protocols. So we provided a protocol template. So this was taking the guideline a step further and saying, here it is. Here's a template that has everything you need in it. Just insert X, Y, Z here throughout. Make it work for your organization. We also provided a checklist recognizing that a number of NSOs had concussion protocols in the first place, and maybe they didn't want to scrap all that and start fresh. So check off to make sure, see if anything's missing, and can correct that piece. It's really important that, especially when we're working across sectors, that we respect each other's previous experiences and each other's expertise, and we don't expect the people we're working with to disregard all the work that they've invested in before. So we have to work with what people have already built within their own organizations. We provided a return to sports strategy adaptation tool. I'll talk about that in a second. Again, making sure the return to sports strategy is tailored, especially when we're talking about high-performance athletic environments. We used a digital platform for a certain period to work with the NSOs. We also offered them access to our expert advisors. So for a sport organization to say, yep, Charles is going to take a look at your protocol and make sure it's okay, or Dr. Bauman, who's a sports medicine expert, that to provide that backup to work with their medical teams as well was a great opportunity for the sport organizations. And we made sure that we offered training on the tools. So again, it's the handing off, but it's also the how-to, this is how you do it. So thinking about when we're talking about sport-specific return to sport strategies, this is obviously just the first 3 steps of an example of when we worked with paddle sports. There are certain considerations for return to sport after concussion, depending on what sort of exertion, what sort of activities are involved in a sport. So for example, going back to canoeing, kayaking, there's certain use of the neck muscles, there's being on the water and how that affects balance in the vestibular system. So we added some of these components right into the protocol, into their sports strategy. So out of the result of this work, and this is one of those things that hopefully these relationships and this work will continue, but as of sort of the official end of the project, we ended up having 42 NSOs engaged in the project, which was over double what we were hoping to achieve. This wasn't just about high-risk sport. We had worked with sports sort of all across the spectrum. It was really interesting to talk to sports like lawn bowling and 5-pin bowling that don't see themselves as, why would we need a concussion protocol? Well, the idea is that concussion protocol is not just about concussions that occur in your sport. What if your athlete sustains a concussion in a car crash, at school, at their job? How are you going to make sure that they're appropriately returning to activity? And even if your sport isn't, you're like, this is a pretty chill sport, they're still going out and working out at the gym. They're still going out and driving. They're still going out and doing other activities. And sport is a really great source of education and guidance through those processes. We also worked with NSOs that never had a concussion policy before, had a full one before, like rugby, like hockey, that have had a lot of attention and pressure over the years. And so we found that the resources and the tools that we offered could be used across the spectrum. Our protocol template by far has been the most used tool. It's without us really investing in the next level of dissemination, meaning getting it to the other levels of sport and outside the sport, we've already seen this protocol template trickle out to local, provincial organizations, which is fantastic. And when in part of our evaluation of NSO engagement, the feedback we got is that the tools that we provided were useful to them. Another important piece of feedback we got was that they really saw the value in health and sport working together to address concussion. In terms of the guideline itself, we've been really happy with sort of the digital uptake. We know there's more uptake beyond this, but we have almost 5,000 downloads of the guideline in less than a year, and lots of visits to the webpage. And of course, this is an avenue also to Parachute's other concussion resources, which include tip sheets for all sorts of audience, more return to sport and return to school information. The second aspect that I want to talk about is education for medical professionals, and sort of where this fits in this harmonization project. Of course, we have a protocol in place. We're saying people, if there's a suspected head injury, get it checked out. And then they go see their primary care provider. Can that primary care provider do the appropriate assessment and give the patient the appropriate updated information they need to support that patient through early care? And what's really important about focusing on the education of our medical professionals is that we know concussion is still a clinical diagnosis. It's still sort of dependent on the individual clinical judgment and the competencies of that individual. We don't have that biomarker yet. We know that early assessment, diagnosis, and getting appropriate management is really critical to outcomes. And we know that sort of assessment, management, referral are really important competencies for our medical professionals to have. So this is kind of what was driving how we scoped out the course. We look to our expert advisory as well as the literature and, of course, the anecdotes we hear all the time. I for the past 2 years, haven't walked into a room without hearing about all the problems in the healthcare system to handle concussion, which we're now taking seriously. So some of the gaps focused, especially in the literature, were the use of symptom scoring scale, consistent use of balance testing, appropriately recommending cognitive rest, as opposed to there's pretty good consistency on physical rest, but not cognitive rest, and also defining to patients what cognitive rest actually means, and also applying return to school and return to sport progressions in an appropriate way. So with that, in terms of proceeding to develop a course, we partnered with our amazing partners at BC IRPU, and Shalina Bubbles in the group today. She's going to hate me for pointing her out. And they already had an existing CAT toolkit for various audiences, and so generously they agreed to work with us. Agreed. And so we're overhauling their medical professionals course and launching a new version in English and French. It's not live yet, but going live in the next few weeks, and we'll be really excited to share that information. It's a free course, and it's accredited by the Royal College. So I just wanted to talk really quickly in the last seconds I have left about some of the really important notes from this work. Of course, government support has been really important. Having investment on a larger scale from the government has been important. So we're going to continue to advocate for the government to continue investing in concussion. Our partners were really important. Understanding the sport context has been really important. I've learned a lot about sport in Canada over the last couple of years. It's complex, just like the health field. So when you're going into other sectors and working, learn about their world. It was really important that we provided clear guidance to sport. They said that's what they wanted. They felt they get a lot of mixed messages from the health field. Tell us exactly what to do so we can do it. So that's what we did. And our emphasis was that the sports own their protocols. They developed them. We provided the tools. We didn't write it for them, and we're hoping that helps with sustainability. I'm out of time at this point, so just wanted to mention a few challenges along the way. One of the big ones was just connecting with the right people. So if you're working with organizations and not really getting where you need to go, sometimes it's just a matter of pushing through till you get to the right person. We just wanted to update everyone. This is the first time we've had a coordinated effort in Canada towards this, and we hope that you all will go check out the guideline, check out some of the tools, and help support using these tools in anyone that you're working with. Thanks very much.
We have time for one question. One. We'll give you a slightly shorter break.
Not from Todd, though. No, go ahead.
Hi, Stephanie. Congratulations on Parachute's work. As we move forward, and it's evidence in this room, the research is moving forward, how are organizations and school boards and physicians going to stay current? Because there will be some that will stay out in the lead, and some that will fall behind, and then we'll be faced with various organizations implementing different things at different times. We're at a point in time right now where there's massive integration right across Canada, but how that will change. What will you be doing? What will your organization be doing looking forward and keeping us moving forward with the new research?
Yeah, thanks, Todd. So this is why it's really important that the investment continues. This is not a one-time thing that we can do and then be complacent about, and we know right now that information about concussion is rapidly changing. We do have some things in place. For example, the CAT medical professional course does have a sustainability plan that will be regularly updated, but we certainly, ourselves as a charity need the support of funding and support of the government especially to continue updating this information. This is why we've tried to do our work at a mass rapid scale, because if you look at it, we're already into 2018. The next consensus conference, we're looking at December 2020. So we're halfway there already to the next one. So it's really important that we work efficiently and quickly on acting on this research, because if we don't capitalize on the research, start implementing and getting people on board for 2-3 years, we're already lagging behind. So like I said, we really need continued investment in order to sustain this, and people need to recognize that that investment needs to happen. It's not a one-time thing.
Thank you for your answer.
Thanks, Stephanie.
Thank you.